11th of March, the CHP has 15,789 PCR positive cases. Case number is 594-518-2610306. Among the 15,789 PCR positive cases, 2,097 are confirmed by the hospital authority. 2,793 cases are confirmed by the public health laboratory service branch, and 10,899 cases are confirmed by private laboratories. And then 15,788 are local cases. On genetic analysis done by the public health laboratory services, yesterday they conducted the analysis on 2,793 specimens, and they did not find any L452R positive samples. 1,055 specimens tested negative against L452R for the remaining 1,778 cases. Some results are still pending, and then for some cases there's not enough viral load. As for rapid antigen test result, in the past 24 hours, 11,558 RAT positive cases were reported, and they've been verified. So yesterday, in total, there were 27,647 positive cases, including 15,789 PCR positive cases and 11,888 RAT positive cases. And for the fifth wave of the epidemic, in total, there are 661,816 5 cases involve staff members. In total, in the fifth wave of the epidemic, 742 residential care homes for the elderly have seen outbreaks or infections. In the past 2 weeks, 409 homes have seen cases or outbreaks. That's 51% of all the homes for the elderly in Hong Kong. And in total, there are 24,270 cases in residential care homes for the elderly. That's 32% of the the reports coming from 164 homes that account for 49% of all the homes for the disabled in Hong Kong. In the fifth wave, there are 6,650 home residents that have been infected. In the fifth wave, that's 36.4% of all the home residents. And then there are also 2,430 staff members infected. That's 23% of the total number of staff members in homes for the disabled. So on death and fatality cases, there are 1,894 cases involving home residents. On death cases, in the fifth wave, there are so far 3,516 death cases. That's an increase of 285 cases yesterday compared to the day before. And the fatality rate has risen to 0.53%. There are 2,178 males and 1,333 females. Age is between 11 months and 112 years old. The median age is 85. There are 5 cases involving children. As for the age group of 18 to 59, there are 156 cases that account for 4.4% of all the death cases. As for elderly, age 6
今日咧，
We reported all these cases of March the 10th of March. 80 passed away. They were unannounced. 57 ranking. I'd like to single out the 19-year-old male for your attention. He had tumors which had metastasized to other organs. Sadly, he passed away. The other one was 46-year-old male. This patient was wheelchair-bound. Our outreach team provided support to him, and we found that he was in poor condition with low oxygen in blood, and he was sent to the hospital, and his condition deteriorated, and he sadly passed away. 960 patients have recovered and been discharged, and 40 patients were picked up during admission screening, and they tested positive, and 70 plus patients became close contacts. We have 10,000 patients, staff members who have come down with COVID, and 6,500 have already returned to their posts. Right, now so it's open for questions. Please identify the organization we represent. Now TV. Today, the positive numbers have come down compared with yesterday. How do you evaluate the situation? Is it getting stable or what? Second, about the self-decoration platform, on the 14th of March, people have to register within 24 hours. Why is it the case? Do you want to speed up the process? And for the recovered patients, you still haven't got a definitive instruction as to whether they should get the third jab. There are some experts who said this morning that for the RAT positive patients, there is a very little incentive for people to report. And my question is, for those who have two jabs, and what advice do you have for them for the third jab? And also, according to the latest guidelines, the civil servants who are suspected to be positive will still have to turn up for work. And there are some working at the maternity and childcare center. They are repositive cases, but still have to turn up for work. Now, for these high-risk places, do you think that the staff members have to turn up for work even if they are repositive? Also, the AWE facilities. It is said that the mainland team is going to take over the AWE facilities. How far along is the discussion? Are there any other facilities in the pipeline that are going to be handed over to the mainland teams? Right, thanks very much for the question. And now TV. The first question is about the trend of the pandemic. The numbers today are more or less the same as those in previous days. We haven't seen any sharp reduction. There is bound to be some fluctuation on a daily basis. The numbers are pretty similar to those in the previous days. Now, over the past week, the numbers are hovering around 30,000 and 40,000. We haven't seen any increase. It seems that it is hovering on a plateau. Recently, the RTD operations have picked up high number of positive cases. We haven't seen any obvious sign of reduction. Turning to the figures, now for the RTD operations, 14th of February to 2nd of March, positive ratio is 13.1% from the 25th of February to 9th of March, the percentage is 13.9%. So for the past 2 days, it's averaging about 12.5%. So in terms of the positive numbers and also the numbers picked up at the RT, the operations, the virus is still pretty active, and there are quite a bit of hot spots there. And the numbers are hovering around a plateau. We haven't seen any sharp increase, but we don't see any particular sign of a downward trend for the time being. We don't have the evidence right now. So the members of the public should not, because of the slight reduction, should not slacken their efforts. They should keep the social distancing measures. If people feel unwell, if they're in high risk factors, they should go get tested as soon as possible in order to ascertain whether they have been infected. Now, for the RAT self-declaration platform, the idea is to encourage people to report to us as soon as they self-test positive, so that we can take public health measures as soon as possible, like the issuance of isolation order for the patient and quarantine order for the household contacts. We hope that through this platform, we should be able to get to grips with the latest situation and to know about the trend. So as soon as one has got the SMS, they should upload the information within 24 hours. They should upload the ID card copy and a picture of the result. We find that after March 7th, there were some people who delayed the submission maybe for a couple of days before they uploaded the information. And if we count the date of the successful upload, there may be some time lag because they're not reporting the latest COVID cases. Third, about the vaccination for the recovered patients, we have the scientific committee under the CHP. We also have the expert committee. They have been looking at the scientific data regarding vaccination, and they would make the recommendation. According to the scientific committee, if a resident in a care home is infected, then within 4 weeks' time, vaccination can happen for the first dose, and after 90 days for the second dose. For the members of the public, if they go for Sinovac, they should, after recovery, go get the first jab within 6 months, and they cover anybody above the age of 3. For those above the age of 12, we recommend that after the first shot, the second shot should take place within 6 months, and thereafter, now for those who take the first shot of Sinovac, they can consider taking BioNTech for the second shot. Now for those who are taking BioNTech after recovery, for those above the age of 5, within 90 days, they can have the first shot. Now, for those above the age of 12, we recommend that they should have the second shot, and that's 6 months after the first shot. The soonest they can take the second shot, it would be 3 months. Now, for the third shot after recovery, there is no need for the third shot. The scientific committee has looked at cases of vaccinated people who get infected. There have been some scientific discussions, and later on there is going to be some recommendation to be put forward. The last question is about the
位同事，佢喺第6、第7日嘅快速抗原檢測咧係 陰性，咁以至到咧佢我哋視為佢康復啦，咁係可以即係返工。咁之後咧就再有一個嘅核酸檢測咧係陽性嘅。咁呢啲個案咧，一般嚟講咧，如果佢係一個近期嘅感染
recent infection cases, the civil servant has got the reporter under PCR or RAT. They've got the test date, and if they have already taken 2 shots, then we will issue the isolation order on day 6 and 7. If they test negative using RAT, it shows that the viral load is pretty low and the transmissibility is pretty low, and they can turn up for work. Thereafter, if they undergo a PCR test, it is likely that, that they may test positive, but we do not regard this as repositive. Maybe in course of recovery, there are still some remnants of the virus, and which are picked up by the PCR test.
欣悉特區政府已經向中央
Dr. Ho, now the hospital authority is glad to learn that the SL government has asked for support from the mainland so they could send people here to help us enhance our capacity to admit patients. The hospital authority will cooperate in this effort, and with the mainland teams joining us, that would help to relieve the pressure we face with manpower at the hospital authority. And then we could reduce serious cases, death cases, and infections, because these are our targets in the fight against the epidemic. Thank you. Over there, please. Good afternoon. I'm from TVB. Just now, other reporters asked about the latest work guidelines for civil servants. That is, if for repositive cases they could still go to work, and there's no need. And for if they're close contacts, they don't have to wait for the infected persons to recover before the close contacts go back to work. So, with for repositive cases, it means that there's no sick leave. Now, for our rapid antigen test results, there is no compulsory requirement for the reporting of RAT positive cases. So, and how can we get a true picture of the epidemic? And what are the criteria for issuing isolation orders? Now, for those who do not comply with the isolation orders, they will be prosecuted. So, would that deter those who test positive with RAT to declare their results on to report the results on this platform? Now, usually people would now go for RAT. That's the general practice, and so there are fewer people at going to community testing centers. So we're wasting resources, which encourage people to take the PCR test. So. Thank you. Your first question about the so-called repositive cases. The latest guidelines of the Center for Health Protection that if there's a case that's confirmed, a positive case, whether it's confirmed by PCR or RAT tests, then on the day of a specimen collection, that would be day 0, and then the isolation period is 14 days. If the person has had 2 doses of vaccine, and then on day 6 and day 7, rapid antigen tests are conducted, and there are 2 consecutive negative results on the 2 days, and the isolation could be deemed to have completed, and then the person could go back to life as usual, going to work and so on. And then for civil servants and other private organizations, employees, they must still observe personal hygiene, wear a mask, wash their hands frequently, and avoid close contact with others and so on. Now, our risk assessment is, given the current situation of the epidemic, if on day 6 and 7, the RT test result is negative for an infected person, that means that that person has a very low viral load in his body. But that doesn't mean that all the virus has been, has been driven out of the body, but then the person is entering recovery stage, but then the viral load would be at a very low level, so there is a very low risk of transmission to others. Now, there are many cases in the community, and we need to ensure operations, various operations could go on. So we want to allow these recovered patients to go back to life as usual and return to work. For civil servants, or others, if for non-civil servants, when they have go back when they have to go back to work, and then the employers require them to take a PCR test, as possible the result may be positive, because after person's been infected, and then the person starts to recover, usually he won't be able to get rid of all the virus in his body so soon. So it's possible if there is a PCR test on, say, day 7, the result will still be positive. But then in these cases, the CT value would usually be very high. That means the viral load is very low, and therefore the risk of transmission is also very low. The second question is about the declaration platform for RAT results. Now, if some of the things that he or she is at risk, or there are symptoms, or the person has been to high-risk venues, or the person has been in contact with other infected persons, then we would suggest that they do RAT test. And if the result is positive, they should report to us as soon as possible. We believe the public will cooperate, and they will report their cases to us on this online platform. Now, this will allow us to have an accurate picture of the latest epidemic situation. On the criteria for issuing isolation order, as I said, it starts counting from the day when there's a positive test result. That's day 0, and the isolation period is in general 14 days. But then, if on day 6 or day 7, the infected person does RAT for 2 days in a row, the results are negative, then, and the person does not have symptoms, then the isolation could be deemed to have been completed. It applies to everyone. And then there are 2 ways for people to do tests. Either they do an RAT on their own, or they could take a PCR test at the testing centers or health care institutions. And for now, if people can't make a booking for PCR test, and RT test is a convenient way, the results are still accurate and reliable. So both tests are acceptable. Over there, the back, please.
From the SNP is about some remarks made by the government advisor, Dr. Hui, in today's morning's radio program. He said that if the government can offer the oral COVID pills for the elderly patients within, on average, 5 days, it will reduce the risk of being sent into hospitals. So would like to ask the hospital authorities, on average, is the authorities able to offer these oral COVID pills to the elderly patients within, on average, 5 days? Second question is there enough supply of these oral COVID pills in COVID hospitals and clinics? And final question is, are there any plans for the HA or the government to speed up the distribution of oral pills to the elderly patients? Thank you.
So concerning the oral antiviral drug, including molnupiravir and also Parvovirus, and for the former one, it's already arrived in Hong Kong, and then for the next, for the Parvovirus, it will arrive in next week. So we have hospital authority experts has already worked up the clinical indication guidelines. And for those indicated, we will dispense the medication or prescribe the medications to patients who in need and according to the guidelines.
Next, please, the lady at the front. I'm from Phoenix TV. in the past 2 days through this online platform for declaring RAT positive results. There are about 10,000 cases or so each day, but then does the figure actually reflect the real situation? Now, because many have said they know friends around them, many friends who've had RAT test positive result, but they choose not to declare on the platform. So it seems that there are no incentives for people to declare their positive results. So shouldn't the Department of Health consider mandatory measures instead of asking people to report their cases voluntarily? Or could you offer some incentives so people will report their cases on the online platform? Are there any means for you to do that? I'll answer your questions in Cantonese. About the online declaration platform, the Department of Health launches the platform because we want the public to report their RAT positive results to us as soon as possible. And we encourage the public to make the most of this platform to declare their RAT positive result. And after we have received the report, we will issue isolation order to infected person and quarantine orders to family members. This is very important. If someone has taken the test and then he does not report to us, then firstly, we will not be able to issue isolation order to the person and quarantine orders to the family members. Secondly, we will not know about the case. Now, for that person, if the person tests positive, he needs to inform us so that we could record his information in our system for confirmed cases. Because in future, when he takes vaccination or even with the vaccine pass arrangement, that would be relevant. So if someone tests positive with RAT, they should report their cases to us as soon as possible. If someone tries to hide their cases, now of course we cannot rule out such a possibility, but still we ask the public for their cooperation, because after all this is a voluntary test that they're doing, and then people carry out these tests on private premises. So we have to rely on the public to report the cases to us before we will know that they have actually done the test. As I said, the reporting is important for individuals and for the government. Thank you.
The gentleman in the last but one row, HKO1. For this self-declaration platform for RAT, some readers are telling us that after the declaration, they failed to receive the SMS and they failed to get through to the hotline. There are some colleagues who said that people may choose not to make the declaration. How serious is the situation going to be? With this compromise your assessment of COVID? And scientific committee Professor Lau Yulong said that those who refuse vaccination should be declined certain services. Is this a feasible proposition? And the artificial island field makeshift hospital is going to be handed over to us today. Now, for this hospital, will this also suffer from any manpower shortage like the other hospitals? Thank you. Well, you said that some failed to receive the SMS. Now, we have also received emails that highlighted this problem. Now, we follow up on this, and we are aware that people do not receive any SMS after the declaration, in particular at the earlier date when the system was first up and running. We noticed this particular issue. The IT colleagues are identifying the issues. If after the declaration they fail to receive the SMS and they file the information again, then they would receive the information that the application has not been successfully processed. Now, we do have an email address. If this situation happens, please let us know, and we'll see how we're going to take it from there. Our IT colleagues, as I said, are looking into this. For the hotlines, if people find it difficult to navigate their way through the system, we do have a hotline for people to call through and report the positive result. But this hotline is there to assist those who find it difficult to navigate through the system. This is a recording system, and all people need to do is to key in the ID number and the phone number, and then we'll take it up and get in touch with them to register the information. Now, we have received quite a bit of inquiries through the hotlines. Some encounter technical problems, and not so much the fact that they don't know how to use the system. So we give guidance to the callers as to how they navigate through the system. The third question is about the pandemic situation. Now, the RAT, each day, the numbers hover around 10,000 or 12,000. We haven't seen any increase. As I said earlier on, we do encourage people to report to us the COVID positive result as to how many people have undergone the rapid test. We would not know until people submit the positive results to us. But the numbers gel with the PCR results. Each day, PCR about 20,000 or so cases, RAT 10,000 or so. The trend is pretty consistent. So through these two sets of numbers, I think we know how the COVID situation is going. The makeshift hospital, I don't have the information with me. The care homes for the elderly, we can see that in terms of mortality cases, a lot of them are involve the residents of the care homes. Now, there are serious outbreaks in the care homes, and the residents are elderly, pretty old in age, and they suffer from chronic diseases that would make them vulnerable to complications or death if they come down with COVID. So we have to scale up the vaccination program for the residents in the old folks' homes. Now, the situation is pretty serious of late. In order to protect the staff members and the residents, the government has been doing quite a number of things. We are encouraging the doctors in the private sector to offer the service. We are mobilizing the vaccination team to conduct assessment on the senior folks and to vaccinate them in order to ramp up the vaccination coverage. Other than the visiting medical practitioners over the past week or so, we have set up 10 outreach teams involving DH and also the HA. We hope that within a fortnight's time, through this outreach vaccination program, we should be able to cover all the care homes for the elderly. The one in far end, please. Ming Pao Daily. This question is for Dr. Ho. Yesterday, there was a man who suffered from acute renal failure after taking the proprietary Chinese medicine Hua Qingwen Jiaonang. And do you think that it is related to the consumption of that particular drug? Now, you also mentioned the unannounced death cases earlier. There was a 46-year-old male who was arrested. When did he test positive? Is it because he couldn't be hospitalized and he had to be supported by an outreach team? Did his condition deteriorate because he wasn't sent to the hospital fast enough? Do we have an outreach team to support all these homes? And there are 10,000 or so people in hospital for COVID. Now, for these HA facilities, how many beds are there available at the moment? What is the utilization rate? And there are 80 or so in the ICUs. And what is the utilization rate there for the ICUs? Now, this question is for Dr. Al. Recently, how many people or what proportion of the people failed to submit the information within 24 hours after the receipt of the SMS? It is said that with RAT positive, there would be medical certificate that would be issued to the patients. And what is the latest progress? There are some residents who are telling us that if someone tests positive at the community testing center, it would take an awful long time for them to get the isolation order. How long does it take you to issue the isolation order? Would people get the isolation order faster if they were to be using RAT than they would if they were using PCR? There is some information about the age range for people, for vaccinated people and unvaccinated people. Perhaps you might wish to release the information separately for the members of the public. Will you consider this? Right, let me address the Chinese medicine, 莲花清瘟胶囊. Now, it all depends on the physical constitution and the condition of the patients when it comes to the consumption of Chinese medicine. So before using the Chinese medicine, one should seek medical advice. Before doing so, we do have a hotline for the TCM, 1-834-511, 1-834-511, Monday to Friday available. Now, the 46-year-old male, perhaps I didn't make myself sufficiently clear. Now, this patient suffer from autism and also moderate learning difficulties. He lived at home recently because of some conditions. He was hospitalized. We do provide outreach team support for the discharged patients. Now, when he was visited, we found that this gentleman had pretty low oxygen in the blood, and he wasn't in good spirit, and that's why he was admitted to hospital for treatment. Now, this patient, his conditions were bad, and he was a high-risk person. As to the ICU utilization rate, at the moment it is more than 80%.
Sorry, speaker did not use the microphone. Now, for half of the beds in the hospitals, our target is to turn them into facilities for COVID patients. We've made announcements already that we have converted a number of hospitals, and then next year we may, convert the whole floor in a hospital for COVID patients and so on. And so for these, we're also doing infection control training for our staff members. We're working on the workflow for treating COVID patients, and we are going to do that for each of the hospitals. Sorry, speakers not using microphone. Now, when he was a bit old, you mean the previous time? Yes, we did not report that in the previous occasion. On the RAT test declaration platform, for most people, after they receive the SMS, they would upload the required documents in a short space of time, so that the information could be verified, and then they could be identified as confirmed cases. Isolation orders could then be issued. Yesterday, there are 11,857 cases where the declaration was successful. And the date of a confirmed case was either yesterday or the day before. For some, they may have done the test on the 7th or 8th, and they only reported the cases yesterday. But we want them to do so sooner, because if they only inform us too late, then they will affect the accuracy of our figures. On sick leave certificate. Now, if someone is a confirmed case and then he receives an isolation order from us, then on the isolation order, we will specify the isolation period and when the 14th day is. In most cases, I think this isolation order could be used as a form of certificate for a confirmed case or medical certificate for sick leave purpose. And then people are probably waiting a long time for admission to hospital or isolation facilities, and then they may have recovered, so they have not gone through either the hospital authority or system or our system. For these cases, now, when we collect sample specimens from them, we would have their phone number, and then we will inform them how they could obtain the proof. We're now working on the arrangement. Hopefully it could come in on stream in the next few weeks. So for patients who were not admitted to hospitals but who were infected, we could then issue them with some sort of proof. We will be announcing the details later. And then for patients who test positive through PCR test done, say at the community testing centers, if their case is positive, they will receive an SMS with a link. Here we're talking about PCR test, so the link is not the same as that for RAT. Now, if someone has a test positive with PCR at the community testing station, we would ask them to submit their information through this link on the SMS. We have now an automated system, and then quarantine orders would be issued to family members. As for the infected persons themselves, when we have the information, they will inform the Security Bureau as soon as possible to arrange for these people to go to community isolation facilities. And we are not issuing isolation order through the automated system. We will be enhancing the system very soon. In relation to PCR positive test. So we could then issue isolation order to the infected at the first instance. On analysis about vaccination, we announce the information about vaccination relating to death cases every day. So for those who've had just one dose or two doses, or who have not been vaccinated, we'll explain the difference. So we explain that every day. So on analysis about the type of vaccine administered, well, that is rather more complicated, because we're seeing the majority of the death cases involved the elderly, and most of the elderly did not get vaccinated. And for the elderly, if they do get vaccinated, usually they will go for CoronaVac. So if we have to do a breakdown of the types of vaccine administered, then it's rather complicated, because we have to do complex analysis. We have to look at the reference age group, and then we have to look at the ratio of people who have taken either vaccines. Later on, if we have more information, then we could do this analysis. But at this point in time, scientifically, we can see that both vaccines are effective. And then for most death cases, the disease either did not get vaccinated or they only had one dose of vaccine. So we will keep reporting such information. Next, please. Good afternoon. I'm from Commercial Radio. Two questions. First one. This morning, the chief executive mentioned that the electronic wristbands are no longer distributed to those under the Stay Home Safe scheme. But that won't be a loophole. But actually, would it be a loophole? Will you not be able to monitor the infected persons? And do you have and also, would it affect the way you analyze data, because you won't get all the data? And then today, there's a member of the public that told the newspaper that he was confirmed on the 1st of March, and then he was in home isolation till the 10th. But then on the 10th, there was an RTD operation in his building, and then he was forced to go to a makeshift hospital, and then he stayed one night, and then he was told to leave the facility. The general public have been most cooperative in this wave of the epidemic, and we are not seeing any prevalent breaches of the orders. Even if there are no electronic wristbands, we don't see people leaving homes, their home, when they have these orders imposed on them. But of course, we will be monitoring the situation closely, and there will be random checks, and measures will be taken for restriction testing operations. Now, if there is such an operation, then all residents in the block have to be tested. For confirmed cases, maybe they have just recovered, or they tested positive not long ago. And then if a person tests positive with either RAT or PCR, there's no need actually to do another PCR test, because the person is already a confirmed case. So in an RTD operation, staff members will inquire whether the resident has been a confirmed case or not. If the person could produce proof that he's a confirmed case, for example, we can show his MSN with a link that he's a preliminary positive case, or he already has been issued with an isolation order by the Department of Health, then in general, there's no need for this person to do another PCR test. Of course, in the course of an RTD operation, there are a large number of people involved, and some people may not know that if they have become confirmed cases recently, they don't need to do the PCR test again. And if they do test positive with the PCR, they could explain their case to the commanders on site, or they could show the isolation orders that they have received, and then our staff will make a suitable arrangement. But put another way, if a resident tests positive in an RTD operations, we're talking about large number of cases, because, you know, in nature, such exercise, we may have some 100 positive cases or more. And in our database, in the fifth wave, we have recorded some 500,000 to 600,000 cases. So maybe it's not possible for us to find out the first instance whether a person has become a confirmed case recently. And then for our colleagues on site, after they have done risk assessments, before they can confirm whether that's a known confirmed case, they will issue another isolation order to that person. And then when that person is sent to the isolation facilities, he could explain his case to staff members at the isolation facilities, and he could also show his previous confirmation information to our staff, and they will certainly follow up on this case as soon as possible. In general, the isolation period starts counting from the first day when the person tests positive. That's day 0. And if the person has had 2 jabs, and then on day 6 and day 7, the RAT results are negative, then the person could leave isolation facilities. And if the test result is positive, then more tests will have to be done. And as long as there are 2 consecutive negative RT tests, then the person could leave the isolation facilities if they have been vaccinated. But if they have not been vaccinated, then they have to stay for the full 40 days.
Let's make it the last question, a lady over there. Cable TV. For the SMS link, you mentioned that it will lapse after 24 hours if the senior citizens do not know how to use the system and miss the deadline. What's going to happen? Would you still regard them as positive cases? Also, the CSB's guidelines for the repositive people to turn up for work. Is it the right time to change the protocol? And how many repositive cases are there for the repositive people? Do they have to resubmit their repositive result? How can they differentiate whether it is a reinfection or whether it is a repositive case? And like how many days does one have to allow for this to happen? Also, the retrofitting of the hospitals, some general wards will be turned into a negative pressure ward. What is the progress so far? In Kwong Hospital, the utilization rate is 64%. Why 64%? Why so low? Is it because of the retrofitting exercise that people can't be admitted to the ward? And also the ventilating fans. The government is really paying over the odds for the ventilating fans. Why do you have to pay so much higher for these? Now, some said that the quality is different. How different is the quality? We've also some comments from the viewers that they haven't received any confirmation numbers, that they have notified the positive case, but they have never received any confirmation number. And that is making this impossible for them to be exempted from vaccination. Are there many cases like this? My final question is about the Asia World Expo. Now, there are mainland medical teams that are coming to Hong Kong, and they study medicine in Chinese, which is different from the Hong Kong system. Would there be any communication problems when these medical teams are coming to Hong Kong? What sort of role do they play? Would they be seeing patients, or would they be prescribing medication, or what? There are some photos online that show that the online system of the AWE has been changed into Chinese. Is it really the case? Would there be a Chinese system that would develop to cater for the medical team from the mainland? Thanks for your question. About the SMS. Now, the link will be there for 24 hours, mainly because we hope that the residents will submit the information as soon as possible. They've already successfully logged on to our platform, and they've already submitted the preliminary information. Hence, they have the SMS. The SMS link is for them to upload the ID card copy and also a picture of the positive result using RAT, so that we can regard that as a positive case for isolation order to be issued. I hope that the residents would get this over and done with as soon as they receive the SMS link. Now, for senior citizens, I'd like to urge them to pay particular attention to the SMS on their mobile phones. If they do, or as soon as they do, they should upload all the relevant information. If the senior citizens find it difficult to navigate through the system, they can seek help from people around them. And I'd like to urge members of the public to render assistance to the senior members of the household if they do not know how to use the digital platform. Of course, if the family members can help the senior citizens to submit the information, then they should be able to upload all the relevant information. If they have any particular problems with regard to the technical issues, they are welcome to call through the hotline. We will render assistance as best we can. Second, about the civil servants, this morning the chief executive and also the secretary for civil service have already explained the situation for civil servants. If the CHP has confirmed a positive case, then the isolation period would start from day 0, the day the specimen is collected, like everybody else, on days 6 and 7. If there are 2 RAT negatives, then they should be able to resume their duty. Generally speaking, for positive cases, there is no need for them to undergo PCR tests within a short space of time, because they have already been confirmed as COVID positive. They resume their duty and undergo PCR test, and if the test comes back positive, in a short space of time, the CT value would be very high. Now, this is what happens for the hospitalized cases. We can see that from infection to the time they get a PCR negative result, it would take about 10 days. So these positive results liable to happen. These may or may not necessarily be repositive cases. It's just that there are still some remnants in the body, and the transmissibility is pretty low. When civil servants are discharging the duties, they have to observe the COVID protocol, keep their mask on, and observe personal hygiene. There shouldn't be any close contact with the family members in order to minimize the risks. Now, for these recovered patients testing PCR positive, they are not reinfection at all. By reinfection, it means that it is another case of infection after recovery. In Hong Kong, the predominant trend is strain is Omicron. The subvariant, this subvariant is pretty common. We haven't seen any new strain. According to some evidence, if someone is infected with a strain within a short space of time, there would be immunity to the strain within a period of time. That may be after a couple of months. We're not sure. Now, Omicron has been around for a couple of months. It takes a bit of time for us to observe the situation. There may be some new variants that occur that may cause some reinfection. But if someone is infected and recovered for after some time, it is more like some remnants, not instead of any reinfection. As to the ventilating fans, I'd like to say that the report is incomplete, and the facilities are tight in supply, and because of the supply chain disruption, that there are problems with the supply, and there is no regard to the varying level of qualities. Now we have to procure 1,500 ventilating fans by end of February. This would increase the ventilation and increase the ability of the hospital authority to admit COVID patients. We do have the established mechanism to commission the contractors to deal with the procurement, delivery, and maintenance of the equipment. The contractor inquired with the supplier. The model that was referred to is out of stock in Hong Kong. If we have to procure up to 1,500, it would take 1.5 months to 3 months for delivery to be taken. So the HA has got in touch with the liaison office, Let's Go, and the various parties to make sure that we can successfully procure all these equipment. Now, for online purchase, the procurement, the delivery, and after-sales service may not be able to measure up to the stringent requirements of the HA. So I hope that you will understand that. Now, for Guanghua Hospital, the 64% bed occupancy, we're talking about the surgical ward, the general ward, not COVID patients. And for our system, we do have a different language system, and we can switch between the two. That's it for today. Thank you all very much.